Hello, everyone, and welcome to our session for today. Today, we will have an introduction about PLAB2 or CPSA. PLAB2 and CPSA are two names for one exam. The GMC used to use the name PLAB2. They're still using it, but recently they introduced a new name which is CPSA. Both of the names are for the same exam, the same OSCE exam. All right? I'm going to mute all of the participants. All right? If I just ask a question, needs an answer, yes or no. So please open your mic, say yes or no. And I can see, it's okay, I can see the chat box here. All right? So no need for, opening your mic. Okay, so welcome again. And thank you for attending. All right? And hopefully it will be a very, very insightful session for all of you. This is Dr. Sahar Ali. I am one of the doctors working in the NHS in one of the hospitals in the UK in acute medicine. I'm the founder of PLAB2 Warriors groups. Also, I am a simulation faculty for the junior doctors in my trust. In addition to that, I am PLAB2 mentor. I have an experience in PLAB2 mentoring for around 5 years now. And Alhamdulillah, I helped hundreds of doctors to pass either through my course or through the free sessions. Alhamdulillah. So let's get into our agenda right away. What's our agenda for today? We are going to talk about what is PLAB2 or CPSA test, the ideal exam preparation, and few minutes about the upgraded course system. All right, let's first start by what is PLAB2 or CPSA test. PLAB2 is the short form of Professional and Linguistic Assessment Board. CPSA is the short form of Clinical and Professional Skills Assessment. As you can see, both of the names are emphasizing or highlighting the word professional, professionalism. So you have to be professional in dealing with your patients and their relatives, and you have to be professional with your colleagues. In the exam, you will have cases or scenarios. In these scenarios, you will deal with patients or relatives or colleagues. All right? So it's very important to be professional. Yeah. It's an OSCE exam, objective, structured, clinical exam. In any OSCE exam, you will be examined in a circuit. This circuit consists of rooms, different rooms. In each room, you will have an exam on a specific scenario, all right, in a period of time, in a specific period of time. All right, inside the cubicle or inside this room, you will deal with a simulator. In addition to that, inside the room, you will find an examiner. The examiner has a checklist, and based on the checklist, you will be assessed. You will be assessed on how much did you do or did you fulfill from this checklist. You will be assessed on the data gathering, your ability on gathering the correct, the relevant data, which is relevant to this specific case or specific scenario. You will be assessed on your management, you reaching the diagnosis and formulating a management plan which is suitable for the patient's circumstances and the patient's condition. In addition to that, you will be assessed on interpersonal skills. Your interpersonal skills. How did you start the station? Did you start the station in a friendly and nice way? How you are sympathizing and empathizing with the patient throughout the case, and how you acknowledge and comment during the case, and how you close the station nicely. All right? Okay, so the exam covers everything a UK trained doctor might expect to see on the first day of Foundation Year 2. Any case that you are going to be assessed on in this exam, you will have it either in the first day or the second day, or in any day once you start your training as a foundation or FY2 doctor in UK. All right? This exam tests your ability to apply knowledge to the care of patients, not how well you can remember and recite facts. So this exam, and I always say that, this exam is very, very different from any exam that you had before. The exams that you had before were testing your knowledge, your ability to recall the information. Okay? This exam, no, it doesn't rely on assessing your knowledge. Yes, there is a part of the exam in which that you are going to be assessed on your knowledge, but the main part is relying on the assessment of what? Of being a safe doctor, being skilled in your communication, on being capable of taking correct decisions. All right? So, a small part, which is knowledge, okay? On top of your knowledge, you will be assessed on being safe, skilled in your communication, and capable of taking decisions, correct decisions. All right? Okay. What is the exam format? The exam consists of 16 cases. As I mentioned before, it is in a circuit, in different circuits. This is one of the circuits from the GMC. It's from the GMC website. So at some point in your exam, when you go to your exam, you might be in this circuit. All right. This circuit consists of 16 rooms, 16 different rooms. In each room, you will have a scenario. All right, 16 different scenarios. All right. So once the exam starts, you will spend 9.5 minutes on each case. 9.5 minutes on each case. 1.5 minute outside the cubicle. The doctor is standing out for 1.5 minutes reading the question. As you can see, the question is on the wall here. All right, you will read the question and process your mind in 1.5 minutes. You will ask yourself what I'm going to do in during this station based on the question. What are the questions that I can't miss once I enter the cubicle during the 1.5 minutes. Once that the 1.5 minute finished, you enter the cubicle, the bell will ring, and you enter the cubicle. During in the cubicle, you will spend 8 minutes. 8 minutes. Um, After 6 minutes, you will hear a bell ringing, telling you 2 minutes remaining. Once you hear 2 minutes remaining, this means that, okay, I will try to do my best to complete everything in these 2 minutes. Once the 2 minutes finished or completed, you will hear a sound, move on to the next station. Once you hear move on to the next station, you get out and you move on to the next one, the next room, okay, and so on, in a circuit or in a circle. All right. Between the 16 cases, you will have 2 rest stations. And when I say rest, it is rest. You have to rest, to relax. Just avoid thinking about all of the misses that you might have had before in the previous cases. Just rest. Rest your mind. Rest. Relax and restart. All right? You rest to complete the rest of the exam. All right? Okay. So this is in terms of the 16 cases and 2 rest stations. The exam will be held in 2 different buildings, either Hardman Street or Hardman Square. How to know where is your exam? From the booking confirmation email from the GMC. They will tell you where is your exam exactly. Is it in the street or in the square? All right. What are the settings that you might face in the exam? You will face face-to-face consultations, video consultations, phone consultations, Simman. Simman is the talking mannequin, and we are going to talk about Simman, and I will show you some simulations from Simman from our courses. From our course. And mannequin cases. In mannequin cases, you will have a mannequin. You will be provided with a mannequin. You do examination or any procedure on this mannequin, like abdomen, arm, to perform phlebotomy on the arm, all right, and so on. Prescription cases. In prescription cases, you will write prescriptions. You will write some medications to the patient, either in patients or out patients. Okay? All right. These are some pictures from the GMC building inside the cubicles. As you can see, this is face-to-face consultation, phone consultation. The phone is here and you're talking through the phone with another person. This is the Simman, the talking mannequin. This is a mannequin of eye examination. This is a station in which you are going to examine a patient. Okay? Examination on a real patient. And this is a procedure station. You have an arm here. I don't know if you can see arm, and then you do the candidate is performing phlebotomy on the arm. The examiner is here, observing, has a list, a checklist. The examiner has a checklist, and based on this checklist, you will be assessed. All right? Okay. What is the theme of the exam? The exam doesn't have a specific theme, to be honest, all right? But in the exam, you will have a combination of these approaches. What are the possible approaches that you can find in the exam? You can find the history-based cases or history-based approach. In history-based cases, you deal with patients who are presenting with a specific symptom. And through this symptom, you ask series of questions and take the medical history of the patient, and then you reach a specific diagnosis. All right? This is the history based. Why the name is history based? Because the patient presents with only symptom. You don't know anything about the patient apart from the symptom and the age of the patient. Then you need to take a perfect focused history to reach your management. All right? History-based cases include medicine cases, all medicine cases, some pediatric cases, and some gynecology and obstetric cases. All right? You also might find counseling cases. In counseling cases, you deal with patients who need advice. The patient is coming to you asking for an advice about their medical condition, an advice about their medications, an advice about their test results, an advice. All right? So you advise the patient and guide the patient to the correct way. All right? Um, Explaining test results is one of the approaches. In these cases, you deal with patients who had test results in 2 weeks or 3 weeks, and they are presenting today to know what are the test results. So you should be able to explain these medical jargons to the patients in a very simple language. All right? You also have ethics approaches. In ethics, the exam covers angry patients, demanding, very, very demanding patients who are asking for unreasonable demands, refusing patients, medical errors, breaking bad news, colleague cases. So all of these approaches are different from each other, and the approach for each approach or the structure of each approach is different. All right? And in our course, we teach you how to deal with each specific approach perfectly. All right? You also find psychiatry cases. In psychiatry cases, you deal with patients who has depression. All right, patient who has depression or psychosis or self-harm. All right, these are psychiatry cases. Surgery approach or surgery cases, you deal with patients in their peri-operative period, either pre-operative assessment or post-operative assessment. In addition to the practical part, the practical cases. The practical consists of SIMMAN, examination, procedure, prescription, and teaching. In teaching, you teach your student or your colleague a specific topic or a specific examination. They assess your teaching skills. All right? All right. So, what is the passing score or how to pass in the exam? To pass the exam, you have to pass the passing score of this day and a number of stations. The number of stations used to be a fixed number, which is minimum of 10 cases, all right? But nowadays, no, it's variable. And no one can know what is the specific number or the number of stations that needed to pass the exam. It's different from day to day, from circuit to circuit. All right, this is what they introduced recently. All right? There is no specific number of stations to pass, but you have to pass both of them, passing the score and a specific number of stations, which is variable from day to day and circuit to circuit. All right? This candidate passed the score. This is the total score of the candidate. He got 100 as a total score, and the passing score for this day is 95. So he passed the score, and most probably he passed the number of stations. If we can say he passed how many cases? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So 10 cases. So the minimum number of cases might be 9, 8, or 10. All right. Okay. Just to for you to be aware, uh, uh, for each domain, I've discussed before that you will be assessed on your interpersonal skills, data gathering, and management skills. In each domain of these, you have to get 4 marks to get the full mark. The full mark is 12. All right? 4 for interpersonal, 4 for data gathering, and 4 for management for each single case. All right? This is in terms of the quantitative marking domains, or the numbers that you can get in the exam. All right? There's something called qualitative marking domains, which is the skills areas. In the skills areas, you will be assessed on 10 skills areas. Your ability to talk with the patient in a very simple language, your ability on actively listen to the patient, your ability to building a very nice friendly rapport, your ability to formulate a relevant and systematic management plan to the patient, your ability to diagnose or to reach the working diagnosis, your ability to examine the patient properly, your ability to find the specific findings. In each case, there are some findings, either in the history taking, or in the examination, or in the investigations. If you find these findings and you reach the right diagnosis, then you will be in the safe side. All right? In addition to all of these skills, they assess also you on your ability on perfect time management, on touching on the issue of the case. Each case has its specific issue. And in our course, I teach you the issues of each specific case. All right? And lastly, your ability on leading a logic and systematic consultation. All of these skills are very important for your performance. In our course, we guide you, we help you to master all of these skills. All right? As you can see, this candidate had a problem in the diagnosis in 4 cases. He didn't reach the right diagnosis in 4 cases. He had a problem in the examination in 3 cases. He had a problem in time management in 2 cases, and so on. All right? Okay, so this is in terms of qualitative and quantitative marking domains. And this is a quick overview on what is PLAB 2 or what is CPSA. All right? Let's move on to the ideal preparation. Do you remember our agenda, doctors? our agenda is talking about what is PLAB 2, what is the ideal preparation, and a few minutes on the upgraded system in the course. All right? So this is the second point in our session, our second agenda, which is the preparation. You have to be prepared or well prepared or fully prepared instead of being unprepared or underprepared. If someone asks you, "Are you prepared?" you have to answer him or her, "Yes, I am fully prepared or well prepared." Okay? All right. So let's talk about the key factors in the preparation. Let's take one by one. We have 1, 2, 3, 4, 5, 6, 6 main factors, key factors in the preparation for PLAB 2. Let's take the first one, which is average time to study. What is the average time to study for PLAB 2? From 3 to 5 months. From 3 to 5 months. Minimum is 3 months. Ideal is 4 months. Perfect is 5 months. All right? Less than 3 months, this will be very, very, very tight. More than 5 months, you will lose the incentive. All right? So from 3 to 5 months is okay. If you are going to join our course, you can complete the course content, the theoretical part and the practical part and everything in 3 months. Complete everything in 3 months with the practice. All right? And then after that, you revise by yourself or with your study partner for another month, and another month for refurbishing your technique and practicing on the high yield cases. All right? So 5 months is perfect. All right? Okay. Let's talk about courses and academies. Which course, which academy, and when? When to subscribe in any course or when to join any academy, this depends on the course and on the academy. You can just ask the mentors in the courses or in the academies about the ideal time to subscribe or to join the academy. Okay, for my course, if you have 3 months before your exam, this is the minimum time to subscribe in the course. Okay. Which course or which academy? Well, it's very variable. It depends on the learning needs and depends on the personality of each person, each doctor. My advice to you is just attend the free sessions of the mentors, watch the free materials for each mentor, and then decide which one of the courses suits you, which one matching your learning needs, which one is fitting you the most. My tip in this part of preparation is avoiding following your colleagues just because they subscribed in one of the courses. My advice is just attend or subscribe in the course which is fitting your learning needs. All right? Which is matching your personality. Okay? If the course doesn't match your learning needs or your personality, believe me, you are not going to benefit at all. At all. Each mentor has his or her specific way in teaching, which fits group of people. All right. If the way of any mentor doesn't match your needs, this doesn't mean that you have a problem or that the mentor has a problem. It's about fitting the learning needs. All right. Okay, this is for courses and academies. Sources. Well, there are hundreds of sources which are available everywhere and in every um, group of PLAB 2. Um, if you are going to study alone, you just need to ask your friends or your colleagues about the sources or the available free sources. They can share with you, and then you can have a look at them, and then you decide which one is suitable for you or most comfy to you or you are comfortable with, and then go with it. If you are going to subscribe to any course or academy, all of the courses and academies that has their notes, so you can follow the notes of the courses or the academies. All right. My tip in this part of preparation is to trust your source. If you decided to start or to study from a specific source, please trust your source. If you don't trust the source that you are studying from, this is a disaster. This is a disaster. All right, so you have to trust the source that you are studying from. All right, okay. Uh, let's move on to the next point, which is studying. Studying in PLAB 2 is different from studying to any previous exam. I always say studying of PLAB 2 is symptom-wise and approach-wise. Symptom-wise and approach-wise. This is my tip in this part. Study symptom-wise and approach-wise. What does that mean? In PLAB 2, there are many different approaches. So you have to arrange or to put the cases in their approaches and study the structure of each approach. All right, the main structure of each approach to be able to deal with the scenarios or the different scenarios in each approach. I know it might sound difficult for you to understand all of that because it's new for you, but with time and when you go deeply in studying, you will understand more about what I'm talking about. All right, so this is the meaning of approach based. Symptom based means that um, you study the cases or the conditions based on the symptom. Don't study the condition or the disease itself. In the exam, you're not going to have like can you tell me about what is Down syndrome or what is heart attack? No, they are going to provide you with a simulator. The simulator tells you, doctor, I have chest pain in heart attack. Okay, I have chest pain. And through a series of questions and asking about the medical condition, then you can reach, is it heart attack or not? All right, this is the meaning of symptom based. You study the condition from a symptom or group of symptoms. All right, this is in terms of studying. The next fundamental factor in the preparation is practice. Practice, 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 practice. Practice makes progress. Practice makes perfect. It is the key part in this exam. The key part in this exam. And that's why I have introduced this new system, which is the MentorShield practice, to push you to practice from day one. Before introducing this system, the study plan was watching, studying, and practicing. So it was relying on the practice, but the problem is that people just study and watch and ignore practice. They don't practice. They study for the exam as their study, the traditional way. And this is totally wrong. This is totally wrong. All right? So please practice from day one. Let's have two examples. Let's say that you have 3 months until your exam. If you follow the traditional way, which is studying, watching, and completing everything for in 1.5 months, and then you start your practicing after 1.5 months, you miss 1.5 months of boosting your skills, of learning new techniques, of exposing yourself to different situations, of improving your performance. But what if you start from day one? You have 3 months. 3 months of boosting your skills, 3 months of learning new techniques, 3 months of exposing yourself to different situations, 3 months of improving your performance. So they are not comparable. We can't compare the two ways. Totally different. All right? So practicing is fundamental, as I mentioned. All right? So my tip in this part is practicing from day one. Yeah. The last part in the preparation is taking mocks. There are many mentors. All of them are perfect. You just need to attend the free mocks of all of the mentors to find out which mentor has the way which suits you, so you can take mocks with them, either online or face to face. So there are online mocks online, and face to face mocks in the academies. All right. So you can take mocks online as much as you can, if you can afford, or you can attend the academy before your exam to take face-to-face mocks. My tip in this part is taking mocks with different people, to find out, take the comments from different perspectives, all right? And avoid taking mocks just before your exam. I mean, 2 or 3 days before your exam, I don't recommend that. The minimum time to take your mocks is 10 or 15 days before your exam. So you will have time to improve yourself. If you take the mock just 2 days or 3 days before your exam, if you do bad in the exam, your performance is bad, then the confidence will be very low, and you don't have time to improve yourself. All right, so this is in terms of the preparation. All right, so we have finished now the second part of our agenda, let's talk about the third part, which is the course perks. Let's take them one by one. Alhamdulillah. All right. So the course, in the course, you can find comprehensive case teaching. The teaching of the cases is very comprehensive, yet concise, to the point. So it's comprehensive and to the point. I teach you each single case or each single scenario from A to Z. From A to Z. Comprehensive and to the point. This is the teaching. All right? In the course, you find simulated scenarios. All the simulated scenarios are performed by me using or doing the role of the doctor's role, performing the simulation with a very experienced simulator. All right, using the 8 minutes bell of the GMC. So you can find the time pressure in each case and how to deal with the scenarios during the 8 minutes. The simulated scenarios include the so you can find simulated scenarios on the theoretical and the practical part as well. All right, simulated scenarios on each single approach, including the practical part. All right. Notes and mind maps. The notes provide you with a general idea on the possible scenarios and the possible concerns of each case, and a general guidance for each approach. And the mind maps provide you with all the knowledge that you need to know and all the points that you need to fulfill in each single case. There is a mind map for each single scenario and case on the portal. All right. And I will share with you a sample from the simulated scenarios and the mind maps shortly. All right. The course provides you with top-notch user-friendly portal. Our portal is user-friendly and top-notch. The course is highly organized, systematic. The platform is user-friendly, as I mentioned. You can annotate on the notes and mind maps. You can use your comments. You can use your handwriting. You can highlight on the notes and mind maps. All of your work will be saved for you on the portal. You have everything, all of your studies in one place. Once you want to revise at any time during the day, in any place, anywhere, at any time, you just need to click in the take your mobile, click to reach the portal and revise. All right. You will have an exclusive group for the course subscribers. If you have any query, any question, anything to raise, please send on the group and you will find the response. All right. Proven success. I have helped hundreds of people relying only on my course. Alhamdulillah, many of them relying on my course without any academies or any other courses, they passed with high marks. Alhamdulillah. Then you find the MentorShield practice, which is the new system. I'm going to talk about the MentorShield practice in a specific entity shortly, but I would like to share with you a sample from the simulated scenarios and a sample from the mind maps. All right?
No dullness, no hyperresonance.
Can you hear, doctors? Yes or no? Let me see.
Yes.
Okay, good. All right.
Okay, it seems to be okay. I'm going to listen to your chest, Adam.
This is a SIMMAN, all right? A SIMMAN simulation.
Okay. Your chest is wheezy, Adam. Do you have any asthma?
Yes.
Yeah. Okay. I'm going now to order some blood to check your functions of your lung. Okay, and X-ray as well on your chest. Okay, and I'm going to give you another mask. Okay. I'm going to give you a medication, nebulizer mask. This medication is called salbutamol. It's 5 milligram over 30 minutes. Okay, Adam? Okay. How do you feel, Adam? Okay, you're still short of breath and your oxygen saturation is low as well. Okay, I'm going to give you another salbutamol, okay? And I will add another medication called ipratropium, 0.5 milligram over 30 minutes as well. How do you feel right now? Okay, good. Your oxygen saturation is going up. Okay, do you feel better, Adam? Okay, that's good. Okay, so can you tell me what happened, Adam? Okay, let's assume that we have taken the history, okay, and then we are going to move to C. In C, to make it easy for you, you will move from central to peripheral. You will check the heart sounds, the blood pressure, the pulse, the capillary refill, and the external signs of bleeding, but it's only if the patient is having bleeding. Okay? Okay, let's move on.
Not that I'm aware of.
This is part from the SIMMAN, all right? And by a feedback from many hundreds of doctors, they like the SIMMAN course in the practical course because it simulates the real exam. All right, let's move on to the next part, which is a theoretical simulation, few minutes from it.
Okay. And may I ask you, who do you live with, Jack?
Well, I live on my own. My wife, she passed away 2 years ago, and ever since I've been living on my own.
I'm really sorry for your loss, Jack.
It's okay, thank you.
So, what about your mood?
It's okay.
Okay, that's good. And you've mentioned to me that you are living alone. So, do you think you need any kind of help from our side?
No, I'm managing well, thank you very much.
Okay, that's fine. And do you have any idea what might be causing this? Redness.
I have no clue. I don't know. If you can tell me, please.
Yeah. And is there anything concerning you apart from this? For the purpose of the examination, I will use...
This is part from the examination station.
A special device called otoscope to examine the inside of your ear. It shouldn't be painful, but if you felt any pain at any time, please let me know and I'll stop right away. Okay?
Okay.
Okay. So shall I proceed?
Mm-hmm.
Thank you. I'm going to wash my hands and put my gloves on and let's start. Okay. So by inspection, I can't see any swelling, any redness around your ear, no discharge coming out. Okay, reassuring. So, do you have any pain here, Elizabeth?
No.
Okay, good, good, good. Okay, so let me examine the inside of your ear.
All right, this is a few minutes from the simulation. You can also, sorry, you can also find here a sample from our lovely mind map, easy to remember mind maps. As you can see, all of the mind maps are divided into um, halves, a half for the data gathering and half for the management. In the data gathering, you find all what you need to ask in the present history, in the past history, the highlighted parts which are extremely important, and you have, you can't miss them, and the examination, what you need to examine exactly, what you need to take in your investigations, and then you move on to your diagnosis, how to deliver the diagnosis based on the possibility and the management points based on nice guidelines. All right, very organized, very systematic, and to the point, in addition to easy to remember. All right, let's talk quickly about our new system, which is the MentorShield practice. The MentorShield practice sessions, which are topic based sessions, you will practice weekly with different mentors. The mentors are carefully selected, well trained, passed with very high marks. Most of them are here in the UK working. Uh, their English is very, very good. We are pushing you to talk in English. The exam is in English, so we are pushing you to talk in English and master and release your tongue. All right? You will have weekly sessions with the mentor, with different mentors. You will have follow up from the mentors weekly. They will guide you, they will practice with you, they will comment on your performance every session that you participate in. What were your performance before, and what is your performance now, and what should be done next to improve yourself. All right, you will find motivation and commitment with if you follow the study plan or the practice plan, you will be motivated and committed throughout the journey. All right, you also can find study group, study partner, when you practice in the practice sessions with the mentor, or in the MentorShield practice, you find different people to practice with. You can just send them privately and do your practice, or collect your practice group. You can practice together in addition to the MentorShield practice. Also, we have introduced a new feature or a new tool in our website, which is Study Partner Finder. I'm going to talk about it shortly, but I need just to complete the main points, or the main perks of the MentorShield practice, or in the new system. All right. You also find flexible scheduling, so you can choose from the available weekly sessions the timing which is suitable for you. Many sessions every week with different times. All right. Just choose the time which suits you. You can start at any time in the batch. We will start the new batch in 18th of April this month, 18th of April. All right. So the practice sessions will start 18th of April with me first. All right. And then after that with the mentors. The So the actual studying will start from 14th of April. We are in 5th of April, so don't miss this opportunity. All right, join us and start your studying right away. If your exam is in 3 months, so this is the ideal time to join. All right. Uh, if you didn't manage to attend or join the batch from the start, you still can attend and join us in the middle. It's fine. Start at any time. We will guide you on how to catch up everything and start with us, and then complete the branches or the approaches that you missed in the next batch. All right. Okay. Um, if you don't want to practice with the mentors, if you don't want to practice in front of people, then you have an alternative study plan for you, for your own pace. Watch, study, and practice as well, but this is for you on your own pace. You can just pick up one of the study partners and practice together on the study plan. All right. The MentorShield Black practice also include the practical stations. So we have practice sessions on the practical stations: SIMAN, teaching, prescription, examination. Um, so this will help you if you can't afford attending academies, then you just need to practice, master your skills in the mentorship practice, and then you go to your exam with all confidence without attending any academy. um, if you want to go to any academy, then this practice will help you in uh, uh, having an idea, and help you improving your techniques before you go to the academy. All right. At the end of every 3 months, there will be a wrap-up session, will be conducted by myself. It will be a revision session on the approaches and what are the top tips to boost your performance in the exam. All right. Uh, uh, in terms of the study partner finder, it's a feature or a tool which is introduced recently on our website. You just need to visit our website. You find an icon of study partner finder. Just a click on it and add your information, your name, and your exam date, and you will find a pool of doctors with their exam date. So you can just pick up anyone who has the exam date which is similar to your exam date. Just click on the name and send him a private message, and then you can practice together. So please don't miss this tool and don't miss this opportunity. All right. This is in terms of study partner finder. We have talked about the perks of shield practice. The last point that I wanted to highlight on, or uh, um, wanted to let you know about, is the total weeks of practice. So the total period of practice is 3 months, which is 12 weeks, 12 weeks of practice of theoretical and non-theoretical. The theoretical, the theoretical and the practical part. In each case, you will practice on either two big branches or small different branches. Okay. At the end of the 12 weeks, you will finish and complete every single approach in PLAB 2, including the practical part. All right? And at the end, there is a wrap-up session is going to be conducted by me. All right? With Warriors team, you are in safe hands. You are never alone. From day one to exam day, we will be by your side, supporting, motivating, pushing you to be your best. Your success is our celebration and success, and we can't wait to cheer you when you pass. All right, so this is the end of our agenda for today. I will leave you for your questions. If you have any question, please do share, and I'm happy to answer your questions. Let's see. If there's something here from the start, no, and from here, thank you for the very beneficial session. Thank you, Dr. Noor. Could you please walk us through the step-by-step plan we should follow to pass the exam in 4 months? After watching the recorded video, what should we do next? Well, this is a good question. If you have 4 months, so if you are joining my course, you watch the video, all right? After you watch, so in let's say you are going to attend the practice sessions, the MentorShield practice. So every week we will have practice on 2 different topics. You just need to watch the topic, study the topic from the notes and from the mind maps, and then you attend the practice sessions with the mentors and then practice. That's it. Once you finish the first week, then you go with the second week and then the fourth week until you complete the 12 weeks, and then you will be ready. All right. At the end of the 12 week, we will have a wrap-up session, and then you can revise by yourself for 1 month. So 4 months is ideal. 3 for completing the course content and 1 for revision. How many practice sessions? In total, 2 every week, so 24 practice sessions, including the practical part. Practice sessions are same as mocks, right? What do you mean by this question?
I mean, like, what is a practice session?
Yeah, you're practicing with the mentor, all right? So it's like the mock. In the mocks, I am the patients, and you are the doctor, and we do one-to-one practice in on the cases, all right? So in the practice sessions, yes, this is it's one-to-one mentor to candidate practice, and then they will comment on each one of you, all right? It's like the
So it's like a simulation of the exam, right?
yes, yes, yes. Did I answer your question?
Yes, all right. Yeah,
All
thank
right,
you.
good. Dr. Ahmed Sadiq, do I have to book the exam before starting the course? Well, it depends on your preference. If you want to book, it's fine. If you don't book and you want to um, just to have time, and then you think, and then you book, it's okay for you. But make sure don't book your exam more than in more than 5 months. You will lose the incentives. So 5 months is perfect for you to complete everything. Dr. Hiba, are the mentors available to answer our questions anytime? Inshallah, darling. Also, if I am going to take my exam in 6 months or more, can I work on my schedule or repeat with the next group? I didn't get what you mean, my darling. If I am going to take my exam in 6 months or more, okay, can I work on my schedule or repeat with the next group? Which your own schedule? Can you just switch your mic on and explain to me, Dr. Hiba? Contact number if we want to ask later. Do you cover everything required to pass? Inshallah, everything is required, everything in the course, everything that you require to pass is included in the course. Inshallah, no. With once you start the new batch with us, no need for other resources, inshallah. Would it differs if I start with the start of a new batch or just joined in the middle of the batch? No difference, no difference. If it's better to start with the start of the batch, all right. But if you didn't manage for any reason and you are joining us in the middle, it's not a problem at all. We will guide you how to start and how you catch up with us, and then you can complete the remaining with the next batch. I mean, are the sessions going in a chronological order or are they independent to each other? Oh, that's a good question, to be honest. All right. In each topic or in each week, we practice on different branch, on different branch. So if you join us in the middle, it's fine. It's totally fine. What do you mean by losing incentives? Yeah. So, well, if you have too much time to start, for preparing for any exam, you feel like I'm bored. I can't. Everything is going in a very slow pace, and then usually people when when they have the exam approaching, the cortisone will be high in the blood. All right, so this is the link of losing incentive. I mean, like, the plan in 12 weeks. Maybe I need more due to some personal circumstances. Or you mean that I can join the practice sessions whenever I. Yes. Well, if you want to practice on your own pace, you will have an alternative study plan for you. Okay. Um, it's similar to the practice or the MentorShield, the practice sessions, but in not with a fast pace. Okay, if you want to follow the study plan by your own, it's totally fine. You can join the practice sessions whenever you need. If you want to attend as a listener, it's totally fine. You are more than welcome. If you want to attend it first and then practice after that, it's totally fine. But I highly recommend anyone who has his or her exam in 3 or 4 months to practice from day one in the MentorShield practice. Even if they are not prepared, even if they don't feel any confidence, even if they don't know anything. All right? Attend and participate, but it's crucial to watch the video of the topic. If you are not prepared by watching the video of the topic and reading the mind map, this is a disaster. You are not going um, to benefit from the session. All right, watching, studying, and then attending. All right. Dr. Noor, when will the batch start? the batch, the actual practice will start 18th of April this month, 18th of April this month, and uh, uh, the studying. So you start studying from 14th or even 10th of April, and then the practice sessions will start at 18th. All right. So you start studying for each week a week before. Got me?
I got you, doctor. But where can I see the program? Like,
On the
what?
portal. On the portal, my dear. On the portal.
Okay.
It's shared on the portal.
Okay. Thank you so much.
No worries. All right. So these are all the questions for you. No questions. No more questions. All right. So hopefully I answered all of your questions. Thank you, doctors. Thank you for attending. Thank you for listening. I hope it was helpful for you to decide which is which better for you in your preparation, and how to prepare, and how to decide, and these main things. Thank you so much, and yeah, see you tomorrow, inshallah, at 11 o'clock. All right, a.m. 11 o'clock a.m. tomorrow. All right. Okay. Thank you. Bye bye.